and very excited to move on to our next panel. So switching gears, we're going to be moving into panel number 2. And the title of this panel is Pregnant and Postpartum in a Pandemic, the Impact of COVID on Mothers. I've mentioned this a couple times, and I'm going to keep mentioning it over and over because I think it's so profound. According to a recent Canadian study, when asked about the impact of COVID-19, 72% of new mothers reported an increase in anxiety and depression. That is astronomical. We are up from 20%, 1 in 5. But for those of us who do this work every day, we know it was always more like 1 in 3 women who experience a PMAD. It's just that the shame and the stigma and everything that we just ended on with Rashma keeps women quiet and silent because they don't want to talk about what's really going on for them. This startling statistic makes perfect sense when you consider that mothers have carried the brunt of family responsibilities. Mothers have been the ones juggling infant childcare while working part-time or full-time from home, managing the challenges of online learning for older kids, and maintaining domestic order without any outside assistance, as we just heard. As a result, 1 million mothers have left their jobs on the backdrop of 2.3 million women losing their jobs. This panel that we're about to begin is going to focus on the emotional and mental load that mothers have endured over the past year and the toll that this has taken on their mental health in particular. We're going to try to save the last 10 minutes for Q&A, so please feel free to put your questions in there and we'll get to as many as we can. It is with great honor and pleasure that I introduce to you our moderator for this event today, Dr. Pooja Lakshmin. Dr. Lakshmin is a board-certified psychiatrist and writer specializing in women's health and perinatal psychiatry, a frequent contributor to the New York Times. We are just waiting with bated breath for everything that you add to the Times, Dr. Lakshmin, a medical advisor to Peloton and the founder of Gemma, the first digital education platform dedicated exclusively to women's mental health. She is a clinical assistant professor of psychiatry at the George Washington University School of Medicine and serves on the board of directors of the Maternal Mental Health Leadership Alliance, of which we will have their policy director speaking on our last panel today, and is active in advocacy work and community building through online platforms, including her Instagram page at Women's Mental Health Doc. She's the author of a forthcoming book from Penguin Life that will be released in January of 2023 on the tyranny of self-care, where she offers a novel framework for women to build authentic and sustainable well-being in the face of systemic stressors. Pooja, it is such an honor to introduce you to our audience today and to have you moderate this very esteemed panel. I'm going to turn it over to you to just do brief introductions of our panelists and their titles, and then dive right into questions. I'll be popping back in a little bit later just to let us know when we're winding up. But I hand the mic over to you. Thanks for being here today.
Thank you so much, Paige. It's such an honor for me to be here with the Motherhood Center and to just be soaking in all of the amazing strength and wisdom from all of these women experts in this community. So thank you, Paige, for the lovely introduction. So I'm really excited for this conversation to have kind of an honest chat about how this past year and a half really has impacted mothers. And we have a great panel today. So I'm gonna just go ahead and introduce everyone that's here with us. So we have Dr. Catherine Birndorf, who is a reproductive psychiatrist and the CEO and medical director of the wonderful Motherhood Center. Great to see you, Catherine. And then we have Cassie Shortsleeve, who is a writer and contributor to Women's Health, Shape, Cosmo, Glamour, and she's also the founder of Dear Sunday. I love Cassie's work. We've collaborated a little bit together, so it's great to see you, Cassie. And then we have Dina Bakst, who's the co-founder and co-president of A Better Balance. And I'm really excited to hear from you, Dina, around how the Better Balance has been really kind of looking at helping moms and supporting families during this unprecedented year that we've had. And then we have Dr. Fahimeh Sasan, who is the founding physician and OBGYN at Kind Body. Hi, Dr. Sasan. And I'm also so excited to introduce Evelyn Yang, who is the parent of 2 sons and a passionate advocate for survivors of sexual assault, autism acceptance, and special needs families. She also sits on the board of Culture City, which is a nonprofit that's committed to creating a more sensory inclusive world. And she's also a member of RAIN's National Leadership Council. It's so great to see you, Evelyn. So to start off, following up on those really dramatic statistics that Paige just shared a minute ago, there was a study done in Canada that looked at the prevalence of perinatal mood and anxiety disorders over the course of the pandemic. And, those of us in the field of perinatal mental health were not surprised by these numbers. The study showed that up to 72% of moms who were pregnant or postpartum were experiencing clinical levels of anxiety, and rates of depression as well were really skyrocketing. So Dr. Birndorf, can you tell us a little bit more about some of the reasons that this might be occurring, and sort of what you and your team at the Motherhood Center have seen over this past year during the pandemic?
Sure. Thank you for all the introductions, and thank you for being here. We love your work, and everybody else on the panel. Yeah, I almost feel like saying, have you been listening so far, everybody? Because the answers have been given. I mean, if it hasn't been evident thus far, we are suffering. We are all suffering, right? Every person. But I think it's particularly bad for moms. And I think it's really hard having kids always, but also having kids during a pandemic. So I think that the lack of help and resources and the multitasking that's having to happen, right? You're a mom, you've become a teacher, you're still an employee, potentially if you have a job and you haven't lost it or had to leave the workforce, you're babysitting, and you have no time or sense necessarily of self anymore because it's all merged at the same time. So that's enough, right? But there's also the social isolation, the chronic stressors, and the health problems, let alone the grief and loss that have come with COVID-19. Like the amount of change, some of which have been, some of the fatalities, just the profound grief and loss that's come with that. I mean, that's to name a few. So those are my top reasons why the pandemic is showing an increased number of perinatal mood and anxiety disorders. And I think that this mental health crisis is not going to end when the pandemic ends. So I think that we are looking at a long-lasting effect. And what we're going to do about it, what we've seen at the Motherhood Center is that the phones are ringing off the hook, that we've doubled the amount of patients who've been calling and coming in, looking for support. In some ways, we can't even hire enough people to keep up with the demand. So this is not getting better, and I think it's just going to get worse, sadly. But I will always end on a moment of hope. The illnesses, when they become illnesses, are treatable. And I do think there was a nice article in the Times this morning by a colleague of mine from Cornell, Richard Friedman, wrote about resilience. We're going to be okay. Tough as a mother, right? We are going to be okay. And when we're not, we're going to get treatment.
I love that. One of the things that I find so fulfilling about being a perinatal psychiatrist is that my patients get better, right? Treatment works, therapy works, medication works. And so, when you're in the depth of that postpartum depression or in that postpartum anxiety, it's really hard to remember that, to remember yourself, right? But hopefully folks that are listening and watching today, if you're struggling, just knowing that there's help out there, and that once you get into treatment, once you get on the right medication, if medication's the right course of action for you, you will feel like yourself again. And that's if there is a silver lining to all of this, it is the fact that treatment works. And, like everybody today has been saying, like, these are not new issues, right? Like, this has been the struggle, especially for single parents, parents of special needs kids. These are issues that have been going on for eons, but the past year obviously has put things at kind of a crisis point. Cassie, I wanted to ask you, one of the things that you write about and report on in your work is kind of this juggling act that comes up in motherhood. And Catherine was just kind of referencing that, how it's kind of exponentially increased as now mothers are teachers, mothers are, working from home, just dealing with the mental load of the decisions that you have to make during a pandemic, like figuring out when is it safe to send my kids back to school? Are we going to get the vaccine? Can we see family? Overwhelmingly, moms are the ones that are kind of forced to do all this research and figure out the decisions for the family. So in your reporting, can you share a little bit with us of kind of what you've seen on the ground? I know that you're a mom of two and just had another little one. So I'm sure you have a lot of firsthand experience as well.
Yeah, absolutely. And thank you, Dr. Lakshmin, for hosting this. Great to connect with everybody. But yeah, so I write a lot about maternal mental health, and I'm also a new mama too. I'm 12 weeks postpartum with my second. And, it's like when we talk about juggling, I think about just what I was doing right before this event, even though it's been on my calendar for months. I put down a screaming 2-year-old for a nap and made sure to pump, just in time to get all set up and everything. And I think that's the reality right now, right? Like we're all at home trying to do all of these different roles that were once kind of compartmentalized in different areas of your life. And now it's just all together. And I mean, I think it's exhausting. But as we've heard today, it can certainly feel unfair. I think for a lot of moms, it can wind up feeling like you're not doing enough, right? So when I connect with moms through my company, Dear Sunday, a lot of times they'll say to me like, am I the only one who is going through XYZ? Am I the only one who can't do this? And I mean, Dr. Lakshmin, and Dr. Birndorf, I've interviewed both you guys for stories I've written about this. And it's like the resounding message is, no, you are not alone. Like this is what everybody is going through right now. And I think about a piece I wrote for parents, I think it was last fall, and the title of it was The Hostile American Reality That Is Going Back to Work as a New Mom. And I mean, that was in the pandemic, but I mean, that was true, like, it's been said earlier today, that was true years ago, and it's still true. It's incredibly challenging. And I think, as has already been said today, but it's important to remember that this isn't, one of the sociologists I interviewed for the story, she gave me a great quote, and she said, this isn't a highly individualized problem that needs to be dealt with on an individual level. No, this is a hugely societal issue that has to have big picture fixes. And obviously, that's been discussed today as well. I think that can be frustrating when you're living it day in and day out to some extent, like the policies largely aren't there. So, what do you do? And again, as has been already said today, but I think it's great that we can get so many people together today and talk about it and share our truths, like Paige said, and, find support in each other.
I love that point around how do you as a mother kind of navigate this line between these are social problems, these are systemic failings, but I'm feeling it on a personal level. And like one of the things that I'm just loving, I guess, another silver lining of this past year is that I feel like these conversations are happening all the time now. When I write about mental health, I'm always writing about systemic inequities. The piece that I wrote in February was, this is betrayal, not burnout. This is social betrayal. And I feel like those conversations are happening all the time now. You can't have the conversation about perinatal mood and anxiety disorders without also having the conversation about childcare, without having conversation about paid parental leave. And that, to me, that feels newish. Like, I don't think a couple of years ago, I don't think those two conversations were happening together. So I'll take that as progress. But at the same time, as a mom, you're still in those trenches. Like, you're still juggling, pumping and getting on the Zoom and making sure, that your kids aren't tearing down the house in the background. And, and I guess I would kind of just take to heart what Reshma just said a couple minutes ago around how it's the work of all of us as leaders and experts to come together to really push our systems and hold them accountable, but then also to help our patients and our friends and our family members to be able to have the space to make good personal decisions. So like how she was saying that she goes for a walk in the evenings so that she can really let her husband hold the peace of bedtime. I think making those personal decisions when you can is really powerful. And again, so much of that is based on privilege. You know, we know that Black and brown families may not have that luxury, or women that are living in poverty or single moms don't have a partner that can take over that nighttime shift. But well, maybe that's a good segue, because Dina, now I want to hear everything from you about the work that that the Better Balance has been doing over this past year. I know that your organization has been doing this work for years, but you know, as someone who's a clinician, I'm always just so inspired to hear about what organizations in this space are doing to really hold accountable our leaders. So would love to hear more from you about everything that you've been doing. Oh, I think you're on mute.
Thank you.
There we go.
Such a pleasure to be with you all. So A Better Balance, you know, we're a national legal advocacy organization, and we advance, dedicated to advancing justice for workers so they can care for themselves and their loved ones. And for 15 years, we've been fighting in 40 states for paid family leave and paid sick time and pregnancy accommodations. And now, you know, thankfully with, this heightened public awareness, and with a president, you know, leading, you know, efforts in Congress around paid family and medical leave and Pregnant Worker Fairness Act. But what I really want to say is that, you know, these issues really preceded the pandemic. You know, these were issues that we've had for 15 years. So women who were one sick child away from losing their jobs, pregnant women who really struggled and thought that these were individual problems that they had to solve on their own, and didn't, and felt like there was no support there. And we really, we run a free legal helpline, and the pandemic has heightened those calls by 10, 20-fold. You know, women who are forced to choose between both healthy pregnancy and earning a paycheck, and or caring for a child, and well, let me just say, we recently had a worker that worked at a retail store, and she couldn't work from home, and she had to go to work, and she basically had to make a choice. Do I leave my child home alone, or do I earn a paycheck? But this is a story that we've been hearing for 15 years. But what I really wanted to say, because there's so much to say on this topic, that this problem starts at pregnancy. It doesn't just start at parenthood. Pregnancy, we need paid leave because we need to ensure that the labor of caregiving, that all care work is valued. But what I have seen and argued for 15 years is that it's a pregnancy penalty, and we are not respecting pregnancy in this country, that maternal health disorders, and there's complications that exist throughout pregnancy and postpartum period that are not valued, that are not respected, that are not supported by our law and our lawmakers. So the Pregnant Worker Fairness Act would provide specific accommodations for pregnant workers and for new mothers, so they don't have to choose between a healthy pregnancy and a paycheck. And there's just so much to say in a few short minutes. I mean, we do legislative advocacy, but we are deeply dedicated to providing free helpline, free legal services. So as I said, we've heard from thousands of workers over the past year who just have nowhere to turn, calling government agencies dead end, and we just help educate them and inform them of their rights. We provide, so that free legal services is so important, because so many workers, especially the most vulnerable workers in this America, don't understand that they might have a right to accommodations if they're experiencing complications. They may not understand that they have the rights to lactation accommodations. They may not understand that they even have, most here in New York, thankfully, we fought and won paid family leave. Only 9 states in this country have paid family leave. We need to pass American Families Plan, but there are protections in this country that do exist for workers. So making sure moms are educated and know their rights is really, really important. And so I think I shared some resources. We have a database. We have a state-by-state Know Your Rights resource, because knowledge is power. So while we are fighting to pass new laws, we really need to educate and empower moms to know their rights and support them and meet them where they are, and starting at pregnancy, especially for low-income women who, and there's such a huge connection between, in the pandemic and mental health, pregnancy-related complications. But I could really go on, and we're in the middle of a Pregnant Workers Fairness Act Week of Action this week. And this, it would address squarely this issue around supporting and respecting pregnant women and women who have perinatal and postpartum depression issues. So happy to share more and resources if folks want to learn more. That was a lot. I apologize.
No, this is amazing because, it's something that as a clinician, we don't have this background, right? And so to have a free helpline, and hopefully we can drop the link for that in the chat, to have something like a free helpline that you can give to your patients so that they actually can get a sense of what are my rights. Here's some structure, here's some scripts of questions that I can ask, because a lot of this is around, from a mental health standpoint, a lot of this is around taking agency and having the knowledge, like you said, to ask specific questions to your employer. And, and they might say no, you might live in a state where it doesn't work out, and that hopefully will change, but at least to be knowledgeable enough to ask those questions, I think is hugely empowering. I run a Facebook group that has about 16,000 women in it that started last year. And one of those questions always, we always get questions around like, what are my rights around, being able to pump or maternity leave. And it's just so nice when you can crowdsource that information and say, here's a link, you can call them, So when when you're plugged into these communities, you get the strength of all of the other women who have been through it already. So amazing. Kind of on a different note, Dr. Sasan, I'd love to talk a little bit more about the work that you've been doing. So this is actually near and dear to my heart because I'm actually going through IVF right now. So I can really sort of empathize with, of course, what a lot of my patients are going through. But so I remember last year when all non-essential procedures were canceled because of all of the safety precautions that we needed to take in the height of the pandemic. And there were thousands of women across the country who had their retrievals canceled, who had their embryo transfers canceled, and didn't know, there was no real sense of when all of that treatment would be back online. And I know Kindbody was really working with their community to help support moms and families to continue their fertility journeys. Can you tell us a little bit more about what you saw through Kindbody?
Yeah, absolutely. So I'm Dr. Fahimeh Sasan. I'm a board certified OBGYN and the founding physician of Kindbody. Kindbody is a national network of women's health practices. One of the things that I think is a problem in our healthcare system is that fertility is seen as very transactional. I'm sure you can attest you kind of go to the fertility doctor with that one goal, and then no one's really taking care of you as a whole person. And they kind of hand you off as soon as hopefully a pregnancy is achieved, or if you after a while don't achieve, they're kind of like, okay, we did everything we could. And what we do at Kindbody is we actually provide the full comprehensive care of services under the same roof. So we are full spectrum gynecology, as well as the entire array of fertility services, as well as mental health and nutrition under the same platform, so that we can truly take care of a woman as she goes through what can be, I'm sure you can attest to, a very emotionally trying experience that unfortunately our society doesn't take very good care of women as they go through this process, because it's often riddled with shame of why am I not getting pregnant, and it's not talked about, whereas we know that 1 in 8 couples experience infertility issues. Unfortunately, the woman who's going through it thinks she's the only one. And of course, many women experience miscarriage and pregnancy loss, but as they're going through it, they unfortunately think they're the only one. Whereas up to 40 to 50% of pregnancies can end in miscarriage in the first trimester. And so our mission is to, one, provide that comprehensive care, but to also empower women and men with this information so that no one ever feels like they're the only one. To answer your question, as it relates specifically to the pandemic, so yes, in mid-March of last year, all of New York City, so we're based in New York, all of New York City went into lockdown, and as a result, the American Society for Reproductive Medicine simultaneously also put out an advisory that all fertility services should be halted until further notice. And the idea was no one really knew what COVID, was the beginning of COVID. Everyone really, there was so much uncertainty that have subsequently been cleared up. And but there was wiggle room in it. And what we wanted to do was to be really advocates for our patients. And so the patients who were already mid-cycle, we didn't stop because it really would be a detriment to that individual. I mean, they've already started the injections, and it wasn't like anyone said COVID's going to cause birth defects or it was just this massive pandemonia, as I'm sure we all remember. And so what we did was really abided by the guidelines with safety first, obviously, and allowed our patients who were already mid-cycle to continue, is recognizing the emotional as well as physical distress that can occur. To just stop someone mid-cycle is totally not warranted.
And all the kind of the financial impacts of that too, because the medications are so expensive if you would have started and then had to just stop. And yes.
And not to mention that none of that is covered by insurance typically. So absolutely. And so we, patients that were already in cycle, we continued and obviously took extreme precautions to protect them and our staff from COVID. And then we continued to provide those services for women who were preserving their fertility who had cancer, because obviously the cancer wasn't going to stop, or their chemotherapies weren't going to stop, or their need for treatment wasn't going to stop for COVID to be over. Here we are, over a year later, still dealing with it. And so those patients, we continue to go through with, again, their safety in mind, recognizing that unfortunately they did not have the benefit of time. And then also really advocating for our patients who did have severe infertility issues, where a month or two was going to matter for them, right? A woman's fertility declines with time. And so again, we were really cognizant, and I think that's something we really pride ourselves in, is continuing to work with the individual and really keeping the man and woman at the center of what we do, and recognizing that has to be the focus, and not necessarily just feeding into the craze. Fortunately, the American Society for Reproductive Medicine very quickly realized that their recommendations were not really supported by facts, and some of the extra education that I think the whole world started to experience from COVID allowed them to fairly quickly, in April, they reversed that recommendation and said reproductive health is essential, as everyone in this panel, I'm sure, can attest to. And so then we went back to full swing, and really very proud of the fact that we were able to continue to provide those services, and not increase the exposure to coronavirus in the process.
Yeah, and I remember during that time just how much fear there was, kind of the uncertainty of not knowing when things were going to start back up again. And, like everyone was going through that time at that time. Just, I think the uncertainty of when you'd be able to sort of get back on track was something that was really painful for so many patients. So it's great to hear kind of what Kindbody was able to do. A question that came up that was kind of related, but I guess for Dina, actually, do you know if there's any advocacy around paid grief leave for couples that are struggling with miscarriage or loss? Is that something that A Better Balance works around at all?
Yeah, that's interesting. Miscarriage is covered under a bunch of the sick time laws that we have fought. So it's not specifically called miscarriage leave, but people just take time more broadly. And sometimes it's covered under a disability accommodation law or paid leave. There are some of these states laws and federal bill that would cover that. There's people So it's a patchwork. We have a fact sheet on miscarriage rights, you're right, which I'd be happy to share too. And it breaks down by state, sort of what do you do if you've experienced miscarriage, and it goes through the different current laws that exist that will protect you. It's also in our state by state database.
Perfect. Yeah, I think it's so important to kind of include loss, whether that's miscarriage or stillbirth or
Yes.
Termination for medical reasons. In all of these conversations, one of the things that we're seeing with Gemma as we're kind of looking at growing the organization and growing our services is our first class was pregnancy, postpartum, and mental health, which was a Zoom class. And of course, you know, so many women in that class had also experienced miscarriage. And so eventually we hope to have specific cohorts and classes for women who are dealing with loss, going through IVF, parents of special needs kids, parents who have kids that are or babies that are in the NICU, right? There's just so many places where there can be trauma that, of course, we've seen over this past year. Okay, perfect. Well, I'm really looking forward to being able to have that resource to share with all of my patients and to share on social media too. Evelyn, I'm so excited to be able to connect with you here. And I would love to be able to hear more about your personal experience as a mom of two and such a passionate advocate and activist in the autism space and being a parent in a special needs family. Can you tell us a little bit more about what this year has been like for you and the work that you've been doing?
Absolutely. And first, thank you so much, Pooja, for having me today, and to Paige, you know, for everything you guys do and for organizing this. I've been so excited to have this conversation with you guys because, you know, these issues have impacted me personally and Andrew personally. You know, and just to take a page from Paige about sharing your, you know, your truth, it seems universal. Like everyone thinks that they're alone when they're experiencing one of these issues. And I'm a little bit out of the weeds now where our kids are 5 and 8. But I still remember very, very well when our first son was born. It was not in the midst of a global pandemic, but it was in the midst of a natural disaster. So it was 2012. And if you remember Sandy, if you were around at that time, you remember that streets were underwater, cars were underwater, and there were power outages across the city. You know, the hospitals had a shortage of nurses and doctors who couldn't get in. You know, there weren't cars and gas, all of these issues. And our son was born on like literally the day of the storm, Halloween 2012. So I remember Andrew and I trying to come up with contingency plans. Like, he's like, I'm going to carry you to the hospital if I need to. And I was like, I literally think I weigh more than you right now. So that was like a traumatic period. And, you know, everything that you sort of imagined about how you might give birth kind of goes out the window. And then on top of, you know, the stress, on top of the stress was like, you know, then you're kind of given this baby and it doesn't come with any kind of guidebook, and, you know, you go home. And I was maybe the first of my friends to have a child. And I remember thinking, you know, I'm a pretty competent person. And people have been mothers for, you know, hundreds of years. Like, I know it's going to be hard, but I had no idea that it was going to be that hard. And, you know, I had a support network. I had resources. I had a doula. She was amazing. You know, I had a lactation consultant. I think she saved my life, but nobody told me that nursing was going to be such a beast. It was incredible. In fact, you know, Christopher never ended up latching. So I was like tied to my breast pump for like a year. And, you know, just and to this day, when I hear like a friend, you know, when I hear a pump, I have to take a minute and like breathe, because I think I still have a little bit of PTSD from that. So you know, that experience is, I think of that, and I think of how much harder it must be for women who gave birth this year and then feeling the isolation, you know, that I felt even at that time. I remember the first time I went to the first postpartum OBGYN visit, I remember just like treating it like a therapy session, where I was like bawling, just crying, and my doctor, it was like it was nothing new to him. So, so there's definitely this experience that, you know, so many of us have, and we don't talk about it enough, which is the reason why, you know, Motherhood Center and this conversation we're having today is so important. Over the past year, this pandemic, just mothering school-age children, especially with special, you know, we have 2 kids, they both have IEPs. You know, Christopher has autism, and navigating, you know, all of that, the therapies, the interventions, and the scheduling. Oh my gosh, the scheduling.
It's a full-time job.
Absolutely. And, you know, and I don't have a paid job, but I have, you know, my advocacy work, and I wrote my book, and all of these things, like these projects that I started before the pandemic, so many of them ended up on the back burner, and they're still there. You know, they're still there. And so I feel for all of the working mothers, like we've been talking about today, you know, the overwhelming responsibility oftentimes falls on the mother. And so we have to be really proactive about creating these spaces for ourselves, so that we can feel sane.
Well, I love hearing you talk so transparently about kind of what it has felt like, and the fact that, yeah, this is nothing new, right? Kind of experiencing it a couple years ago during Hurricane Sandy. And, you know, I think one of the pieces too that I'd love to hear more about, I know that you're doing so much work in your own right, but I also want to give space to be able to talk a little bit about, you know, about Andrew. And he's currently the front runner in the New York City mayoral race. He's a former presidential candidate. And I know that this is something kind of supporting families is at the top of his mind. So would love to kind of hear a little bit more about what he's thinking on that front too.
So, and I think the background of like what we experienced as new parents and now as, you know, parents of a young family, can give you some context as to like how much we both care about this subject, because we live it almost still to this day, every day. And Andrew's been talking about these sets of issues for a long time, for years. I mean, he's been talking about the postpartum mortality rate of Black mothers for years, and how it's just, it's horrendous. You know, there should be no reason for it, and we have to do so much more. And one of the things is having an advocate in the room, right? Because we know Black women, they're not believed when they say that they're experiencing something. And it's really hard to be your own advocate when you're in the throes of labor. So creating this pipeline of doulas, or, you know, expanding access to doulas is something very near and dear to our hearts. And again, you know, that, you know, Andrew's always been this champion of a basic income and cash relief. And this, he has a program that will help the poorest 500,000 New Yorkers. And unfortunately, a lot of that number is comprised of women and their children. So that will, you know, hopefully help them raise the floor and level that field a bit. And again, about getting mothers back into the workforce, expanding, you know, universal 3K, and I know he's 100% committed to that, and also expanding affordable childcare. You know, these are the, you know, we talked about like the personal issues, but these are like the structural societal issues that we can and must address.
I see Dina nodding along.
Well, I mean, absolutely, absolutely. So grateful to hear that, obviously. Sorry, I didn't want to interrupt you, Pooja. You were going to say something.
No, well, I was just going to say, I think it's just so powerful to be having this conversation when we're centering mental health, mom's mental health, family's mental health, right? Because we know that family's mental health is integrally tied to mom's mental health. And then we're also centering the structural issues, and that, you know, folks like Andrew really get that, that these two need to be tied together, that mental health isn't just happening in a vacuum, that it's all connected to access to healthcare, to ability to put food on the table, to have a paying job, right? All of these things are tied together. One of the things that I have been thinking so much about in starting and founding Gemma is wanting to make sure that Gemma is lifting everybody up and not contributing more to the gap in resources. So our digital classes are at a really low price point because, you know, a lot of the programs and things that you see online, it's like, you know, it can be really expensive. And we already know that there's such a huge gap when it comes to mental health services. And I think those of us that are clinicians are sort of always thinking about, there's only so much that we can do on a one-to-one level, right? So how do we take that and bring more of that to a larger population where there's already so much stigma? So this is amazing to have this group here. So Dr. Birndorf, you know, I'd love to hear kind of some thoughts from you in terms of, you know, the work that you're doing at the Motherhood Center and what we can do to help support our new and expecting moms with the mental load and with kind of the emotional weight of everything that's going on, having to kind of take on this new full-time job as teacher, you know, all of the different ways that they've kind of endured these traumas to some extent over this past year. What are some of your thoughts about how women can cope?
Well, thank you to everybody for what you've said so far. I feel like we're filling out a conversation that just needs to keep going. And so I think key to the question, or key to the answer to your question, is really talking about it, right? Is just, we can't talk enough about it. And being truthful and sharing our stories is so powerful. And I think that helps people not feel alone and to realize that I love, Cassie, you referenced a sociologist. I'm writing down quotes from today from everything so far. I have a whole page full, different things, but this is a societal problem. This is not an individual, a highly individualized problem. This is happening for all of us. I mean, my kids are 19 and 22. And I'm struggling. And there, you know, I always say once postpartum, always postpartum, because you're always a mother. And it's really hard. You know, I'm working out of one of their bedrooms right now. It's complicated. And I think without people to talk to, without social supports, connection is everything, right? We know connection, social connection improves health outcomes and longevity. And we need that in this pandemic. So yeah, I talked to a friend I hadn't talked to in 30 years from our med school reunion, you know, yesterday. And it was so uplifting. I was like, this feels great. And even though I want to sort of like hide and I'm not minding the social isolation, I know that I have to push forward. I say to myself every day, get out of the house. It's raining in New York City today. I got to go out. It's not an option, right? If you can get to nature, I mean, it's hardly, I'm walking the east, you know, the far east side of the city. It's not that lovely, but it's outside. I'm breathing the air. I'm trying to interact. I think all those things. And then to some of the other points being made, like advocacy, ask for help. So talk about it, ask for help if you can, get an advocate. It doesn't matter, you know, how educated you are. Many women who've struggled have been, you know, OBGYNs, pediatricians, social themselves, and have missed it, right? I didn't realize going back to, I left maternity, my mat leave early because I felt so much more competent at work when I was a resident having my first kid. I didn't realize what that was. That was struggling, right? So I think, you know, talking about it, having someone who understands help you if you can't say it for yourself, all these things I think contribute. And I would be remiss not to say therapy. Right. So friends and family are awesome. But, you know, if you can get access to, and a lot of this is about how do we improve access to, part of what the Motherhood Center is doing is creating access to a particular level of care that literally only exists in about a handful of places around the country. So we're creating a new level, but you just continuing to increase access so that people can get mental health care, particularly women who are pregnant and postpartum.
I love that. One of the things that I've seen kind of come up a lot over this past year is women who are in that pregnant and postpartum space and are kind of saying, well, but it's a pandemic. Everybody's struggling. Everybody feels bad. So if this is due to the pandemic, then it can't really be depression. It can't really be anxiety because everybody feels this way. And, you know, I think it's really important to point out, like when we're making diagnoses, right, or when we're talking about clinical depression or clinical anxiety, it doesn't actually matter if it's coming from an external cause like the pandemic or the social isolation or, you know, the fears about COVID. What matters is your level of functioning. So if you're not able to get out of bed, if you're not able to do the things that you need to do, if everything feels really, really hard and you're just isolating from everybody, you know, if you're noticing all these symptoms and your functioning is really impacted, that's a sign that you should seek support, whether that's through, you know, a support group, you know, at the Motherhood Center, or whether that's if you do have access to a therapist or talking to your OBGYN or your primary care doctor. Go ahead. Sorry.
No, sorry. Just one thing I want to say about talking to your OBGYN. And one of my dreams, again, when I look at it from the inner, is empowering more healthcare providers to be armed with information about the rights that women and mothers have at the work, because they're so siloed, these communities. Like, well, I mean, I think we're getting better, but like so many women, I mean, don't even know that that they can get accommodations if they are having, either throughout pregnancy or a complication or mental health issue. It's pregnancy, childbirth, and related medical conditions. You're entitled to workplace accommodations, but providers, we've done a bunch of trainings, especially with WIC population, with just people, they don't know. And so, we need to bring, we need to do a better job of getting the information, because that's where women get their information, about their workplace rights. They're not getting it usually, especially low-wage workers, from their employers. So we'd love to see more intersection between, between providers and ensuring that workers know their rights. I mean, just one thing I wanted to pick up on what Evelyn was saying earlier. You talked about breastfeeding. We just fought so hard years ago in New York, because there's this breastfeeding Bill of Rights in New York State that said, that you should be able to the right to breastfeed, and that's best for your child. And it was a lot of, for low-income women, they didn't know that they actually had the right to breastfeed at work, right? So they're being bombarded with information that they should breastfeed, but they actually there was no support, workplace support for them to do that, right? If they ask, they're punished, they're maybe given a closet, no time. So we are working on materials and brochures to help move us in that direction, because I think that will help, especially for the most vulnerable women who can't work from home or can't just take for granted that they could take a paid sick day, that's going to be so important. Sorry, I didn't mean to interrupt you.
No, not at all. I think that's the brilliance, I think, of this conversation. You said that was the word that I was thinking of that my brain could not remember: siloed. Everything is siloed. So as a psychiatrist or, as an OBGYN, you don't even know that these are the laws, like these are the accommodations. And I think we just really need to bring together, like what we're doing here, the mental health piece and all of the structural pieces, so that women actually know what their rights are. And I 100% agree.
I completely agree with that as well. And I shared my story of just sort of like breaking down and treating my OBGYN as a therapist. And I think that is the case for a lot of women. That the doctors are on the front lines here. And so we do have to do a better job to partner with them and make sure that they know the information, the right information to tell their patients. And we also need to make sure that we are screening women for PMADs, like 100%. Like, we screen for gestational diabetes and hypertension, and this affects way more women. So we have to make that a screening mandatory in New York.
I also just want to take a moment and just say that as physicians too, we need to take the medicine back into our own hands. And, I was previously at Mount Sinai for 12 years, as part of a very busy academic practice. And, we saw patients like for 10-minute visits, right? And that was the norm. And I'm sure anybody here who's been to your OBGYN recently can tell you that that's about the amount of time you spend with face-to-face with your doctor when you go in for visits. And that's the problem with the system, right? If you only have 10 minutes, there's only so much, not like micro machine people, there's only so much you can talk about in 10 minutes. And as a result, most things that are really imperative and important get left behind. And so that's one of the things, when we founded Kindbody was like, all right, we can't repeat the same things and expect different results. And so, we made it mandatory that our visits are at least 30 to 60 minutes. And we've got to take time and talk to these women so that you can have time to educate people about to advocate for them and to talk to them about fertility and talk to them about miscarriage, because these aren't quick conversations either. And so I really do think that it's time for physicians in our communities to also fight back against these insurance companies that have somehow decided that 10 minutes is plenty of time for a doctor to interact when it's clearly not. And that's a whole different topic of the dysfunction of our healthcare system. But I really do think that we need to advocate. And for those of you out there that are watching, obviously it's going to take time for us to change the system. But I really do implore you to ask questions. And even though that doctor has their hand on the door and is ready to leave, stop them and just ask questions and continue to ask questions. And if you don't feel like your questions are being answered, ask them again, or find the provider who is actually listening to you. And that would be, something I wish I could scream from the rooftops.
Totally agree. I always say never take no for an answer. If you feel something, something's wrong, you are sure you're not getting an answer, you cannot give up, which is really hard when you're down. I think New Jersey's slogan used to be speak up when you're down. I mean, it's hard. It's really hard, but whatever support you can get, just do not, if feelings are legitimate, if we know something's wrong, we know ourselves and our bodies. And so we have to push ourselves to say it, and to don't let that doctor out of the room, or to call back and to say, I forgot to ask a question, whatever it is, or to have someone help you do that. I totally agree.
And I think that's one of the ways that kind of community of other moms is so important, so that you have people that are cheering you on, because when you are anxious or when you are depressed, it's so hard to really go to somebody who's in a position of authority, like physicians are, and feel confident enough to ask more questions, or to say something like, hey, I didn't really understand how you explain that. Can you repeat it again? I always tell my patients, like, take notes, write your questions down, make your whole list of questions, show up with that list of questions, and what Evelyn was saying about universal screening and more frequent screening, not waiting until 6 weeks after you have your baby to see your OBGYN for the first time. I think the next panel, actually, one of my colleagues, the executive director of MMHLA, the Maternal Mental Health Leadership Alliance, is going to be talking about some of the work that we're doing to help really push forward some of that legislation, and also increasing the pipeline. So we have more perinatal and reproductive psychiatrists like me and Catherine, because that's a piece of it too, having more educated providers that specialize in this field. One of the questions that we got is, let's see, can you speak to supporting the mental health team of perinatal therapists that have also had babies and young children this year? So, kind of about the mental health provider burnout and how we all cope. Any thoughts on that? Maybe I'll start with you, Catherine.
Well, as an all-women organization, the Motherhood Center, we have about 40 employees, all of whom are women. And I think we're on our 8th baby. We've been open 4 years. We're literally just going into our 4th year. And at minimum, among staff, 8 babies. And we have a pregnancy now we have one, if not two pregnancies right now. So we talk a lot about what to do, and how to help each other and how to have, a sort of matriarchal experience that feels more flat and collaborative and, just we try to help each other. We try to cover each other. I think that it's been really fascinating. I mean, I come to this company through medicine, not through business. So it's really how do you merge those two or marry the two when they can often be competing needs, right? And what your staff needs to be doing and what they need to be receiving can feel very much at odds. So we spend a lot of time thinking about how to keep our women employees, staff, clinicians, otherwise, healthy. And it's very hard. And we ask, for input. And I don't think there's a right way, but there certainly is a talking about it, considering it. What do you need? What would help you right now? Oh, you have childcare care issues today. I'm telling you, people jump in. Every day in rounds, I have to be out for a pediatrician's appointment. I got you covered. I was writing prescriptions while Laura Polania was on the panel earlier today because she couldn't fill those prescriptions. And I said, I'm in the background here, I'll cover, So it's just, you know what? And it gives me, we jump in, we help each other. I don't know how else I don't know. It's really hard. It's hard. And we are busier than ever. And our staff is really burning the candle at both ends. So it's hard. And we're going on saying, take your vacation. Take vacation. I'm trying to take a vacation next week. It will be the first one in the entire pandemic. And I'm going to try not to be on my phone, which is going to be a challenge. But if I don't do that, what exam am I set? And also, it's not good for me. So just a few thoughts there, but others may have ways that we could use, please, other ideas.
I was just going to add, Dr. Birndorf, just going off of what you said, like a lot of what you're saying is just kind of exposing the truths of motherhood, right? In the workplace, with your colleagues, with your family, take your vacation, teach people about this through your own actions and through supporting yourself in health and wellness in this period. And I think that that's a small way to make change in in your own little circle.
Yeah, exactly. I think kind of that transparency and the bringing it into the room, right? Which I think Zoom has done for all of us this year, right? Just having that be a part of the space that your family life and your personal life. So yeah, I agree. I don't think there's one right answer. It's just having it be a part of the conversation. It's something that's at the top of mind for the leaders in the organization. We got a specific question for Dina. Dina, can you talk about pregnancy discrimination in the workplace from women? I ended up leaving my job as a nurse due to pregnancy discrimination and lack of support from my healthcare provider in advocating for my rights to continue working. I have found women to be less supportive than men.
Pregnancy discrimination, it's alive and well, and it's shocking, and it's particularly shocking that it's pretty prevalent in the healthcare community, right? We recently, as I said, we're doing this week of action right now, and one of the clips, she's a frontline nurse from Texas who had a high-risk pregnancy. Also, as we all know from the pandemic, there was mixed guidance about how, this health risk for pregnancy. Then the CDC came out and said, yes, pregnant women are heightened risk, women of color even more. But she was she was put in a particularly risky situation on the COVID floor, asked for additional PPE that was given to a man with, a autoimmune disorder. And they're like, you're basically no good to us pregnant. Why don't you reapply for your job after you have the baby and take maternity leave? And what happens is, I find that, this was certainly a problem well before the pandemic, but I thought that was a particularly egregious COVID story, right? Of just how, challenging being pregnant in the pandemic really is. But I think that look, I think that the concept that in a world right now today where women, there's blatant pregnancy discrimination, sure. Oh, I'm pregnant. Sorry, you don't have a job here. But the form of pregnancy discrimination that's most alive and well today is just pregnant women that need some adjustment to their work rules or duty to protect their health. You know, we had this whole thing started back in New York when we introduced the New York City Pregnant Worker Fairness Act, because a woman ended up in the ER and their ER doctor said to her, "Why are you here?" She said, "Well, she was dehydrated and they wouldn't let her carry a water bottle on the job." She wasn't allowed to carry a water bottle on the job. Now this is, you know, in retail and food service where women are in the more vulnerable jobs. You know, that is New York. We have made progress here in New York. There's still ways to go. We need to do outreach, education, and enforcement, and we need to pass a law federally, the Pregnant Worker Fairness Act, so all women in this country deserve the same protections. So, I mean, the fact that that still goes on in 2021, and I would just say it's that the law will cover pregnancy, childbirth, and related medical conditions. So some of the things that we've been talking around accommodations for miscarriage, accommodations for breastfeeding, you know, we need to make sure that every worker in this country has those basic protections, and that this is, I think it's a real gap in our civil rights laws. And so, you know, I hope folks will get behind, you know, that fight for this federal legislation while we support the Americans Jobs Plan, while we support the American families. I mean, this is our moment to get paid family leave done, but we need to get this bill done too. And we have a shot. So I can't say anything about men versus women. I mean, I think it's just pervasive across the board.
Well, I appreciate you speaking to that. And it is really horrific and heartbreaking that this is something that's alive and well in our country. I know we have just another minute or two left before we all have to jump off and move on to the next panel. But one question that came in, or one point that came in, was apparently just today that there was a report saying that that we had the biggest fall in birth rates in the past 50 years in our country. And you know, I guess it's not surprising, just given what everyone has gone through this past year, but wondering if anybody on the panel has thoughts around that.
I can actually speak to that. So one of the thoughts actually at the beginning when the quarantine started, you know, across the country and really across the world, was that there was a theory that we were actually going to have a baby boom, right? Men and women or partners were going to be home together all day long, every day, and that was going to create a baby boom, you know, and that we know that from historical data when, for example, or during hurricanes or blackouts or any periods of time where people were forced to be home for whatever reason, that has usually resulted in baby booms. And what actually happened was the exact opposite. And it has been very intriguing for epidemiologists, and that's why that was published. And the reason behind it was there was such an incredible amount of fear, right? We just talked about in my portion a few minutes ago about how even the American Society for Reproductive Medicine was like, stop, don't have babies. There was such an unfounded fear that somehow COVID was going to either cause birth defects or cause miscarriage or affect fertility. And there was also so many things that were inappropriately happening in hospital settings, right? Here in New York, for a short period of time, thank God, hospitals stopped allowing women to have a person with them. Can you imagine, like, hospitals in New York City in 2020 were forcing women to have babies alone because they were worried about coronavirus? And so, I mean, it's backwards, right? And so it's not a surprise if you step back for a moment. We were all nervous to even, like, you know, go outside our houses, so much less procreate and bring a baby into this with all of that uncertainty. So while I think the concept that it was going to be a baby boom makes sense kind of historically, I'm not surprised. And I think it'll take a little bit of time before we do start seeing that uptick. Because even right now, there's so much hesitation on getting vaccinated and when should I get vaccinated as it relates to pregnancy and all of that. And just for everyone to know, There is no data to support that the vaccine is going to harm a woman's fertility, that is going to harm your baby, and actually just this next week or so, they're going to increase vaccinations for children under 16, and I'm sure very soon we'll see it for even 2-year-olds and over. But I do just want to advocate for getting vaccinated. It's so imperatively important for you and your loved ones. And also the idea that we were going to see a baby boom. I think the theory made sense, but in reality, it's correct what did happen, which was that there was a decline.
Well, ladies, it was just so lovely to be able to connect with all of you. I feel like we could, keep talking for hours about all of these different issues. But yes, thank you all for spending time and chatting. And I'll turn it back over to Paige and keep doing all the good work that all of you are doing out there. And thank you so much.
Thank you, Dr. Lakshmin, and thank you so much to all of our esteemed and wonderful panelists today. Greatly appreciate you taking the time and offering your insight. And we will all continue fighting. So thank you so much. So we're gonna transition to just a brief intermediary conversation that I'm gonna have with my dear partner and the co-founder of the Motherhood Center, Dr. Birndorf. So she's gonna stay on with me for just a few minutes until we get on to our next very special conversation between Dr. Aviva Ram and Gabby Bernstein. This would be a great time for those of you who have been with us through the entire day or part of the day to just stand up, stretch, run in place for a few seconds, go to the bathroom, but stay within hearing range, because we wanted to spend just a few minutes in between our last panel and what we have next, talking about something that's really important,